Hi everyone.
Hello, good evening.
Good evening, Sumit.
Hi.
Hello, good evening. We will start the Skillathon in a bit. I'm waiting for the participant to join. Thank you. Hello, all.
Hi Aditya,
Hello.
everyone.
Yeah, very good evening.
Good evening, Aditya.
Hi.
Hi Aditya.
Hello, Sheikh.
Hi, Aditya.
Hello guys.
We have Prakash sir with us.
Yes, this is
Oh,
Prakash.
okay. Okay. So it's good to start now. Hope everybody can see my screen.
Yes.
Yes.
Okay.
Yes.
So very good evening, everyone, and dear jury members. Thank you very much for joining today's Skillathon this Saturday evening. And my name is Aditya, and it's pleasure to be your host for the next couple of hours. So, the Institute of Product Leadership welcomes you all for today's Skillathon, that is customer-centric value proposition by the cohort of the Product Management Certification Program. Our participants will present their innovative solutions, and our esteemed juries will evaluate them on the given key parameters. As Skillathon go, this evening will definitely be an excitement with challenges and the skill demonstration of our learners. This is an event where the top shortlisted learners from cohort will present their hands-on project and portfolio towards assurance of skills and demonstration. So communication, articulation, business modeling, understanding will all be there. Before we get started, once again, I would like to thank all the audience and the jury members for joining us. Today's session is going to be exciting and definitely it will be a wonderful day. So here the audience will not just witness the skill, but they also get the chance to vote and choose today's winner. So before that, let me begin with giving you an insight on what Skillathon is and why IPL emphasizes on Skillathon being the real test of skill. So Skillathon, as you can see, Skillathon is an event where the top performing learners demonstrate their understanding of skills and application of the same in the context of real world product idea as a part of their learning journey. At IPL, we also replaced examination with Skillathon and studying learning by doing. The institute strongly believes that the real test of skills are demonstrated by ideas in the live audience and to the industry experts. So before we go further, I'll just give you a glimpse of what product management certification program is. It is a globally recognized program with assurance of skills versus knowledge and focus on career transition, career acceleration through learning by doing. Now it's time to introduce our panel of juries. Today we have prolific juries of 3 members of the leading industry. Start with Prakash sir, Director of Product Management at OpenText. Welcome, sir.
Thank you, Aditya.
And we would love to hear about you. You can use another next 30 seconds to introduce yourself to our audience.
So I'm Prakash. I have been in industry for around 22 years. I have been in product management segment for around 14 years. Played different roles. Just like most of you, I started as a different, I mean, in different role, software development and business analysis and IT consultant, and then moved into product management role. And since then, I have worked in various kind of organizations, startup to mid-size to large scale, and built a lot of customer-centric product. So I'm here to help you out with the journey what you all are having. I mean, sometime back, I'm also did my certification from IPL Institute. So in a way, I was there in those seats sometime back. So welcome everyone, and all the best.
Thank you so much, sir. It is really an inspiring thing about the way how you transition, because that is the most question that we usually get. Thank you so much for your kind words as well. And now, next we have Ravi Shankar sir, product leader at Reliance Jio. Welcome, sir.
Yeah, thank you, Aditya, and hello everyone. I'm Ravi Shankar, and I work at Reliance Jio. Just like Prakash, I had also started my journey as a software engineer, and then moved on to requirements analyst, and I was also a Scrum product owner, from where it was a jump towards product management. So I've been in the industry for almost 25 years now, and yeah, it's been exciting. And again, as Prakash said, I was also part of ICPM 12 years back, and we didn't have the Skillathon at that time, even though we had to present to a jury during our final immersion. And I'm looking forward to this, and hope to see some good ideas and insights that would enlighten. It's always a learning journey. So all the best to all the participants.
Thank you. Thank you so much, sir. And next we have Anshul Sharma, Senior Director of Product Management at Symphony.
Hello, guys. A quick brief about myself. As Prakash and Ravi mentioned, I also started as a techie, moved to consulting, and over the last several years, I've been building and scaling platforms and products which are SaaS and AI first products across global markets. Over the last several years, I've owned P&Ls, build AI products at the intersection of data, AI, enterprise operations, partnered with executive leadership, managed multi-product portfolios, and managed teams across global markets, including US, Europe, and India. At present, I'm with Symphony AI. I head the product line, which is called Store Intelligence. Think of it as eyes in the retail stores, which include shelf cameras, ESLs, mobile apps, etc. Really excited to spend next couple of hours with the group and learn something new here. So all the best to the participants.
Thank you so much, sir. All the three juries that we have today is very much inspiring stories they have. And today we will be able to get to learn from them as well. So once again, a very warm welcome to all the juries. Thank you for taking time to join us for today's Skillathon.
Thank you, Aditya.
Thank you, sir. So here is the guidelines, and it will be 10 minutes of presentation for each team, followed by 2 to 3 minutes of feedback by juries. And I'll give you a heads up at 7th minute during the presentation, and the 10th minute will be a hard stop. Okay. Now, juries will cast their votes, a scale of 1 to 5, and 1 being the lowest and 5 being the highest. Juries can use the rubrics to evaluate the performance based on the given parameters. The scores will be announced by the juries aloud. Once the presentation is done, the audience will keep your phones ready so that you can scan the QR code that comes up on the screen and cast your votes too. Okay. So let's have the presenter of the day. That is Sonali Das and Sheikh Mohiddin.
Thank you, Aditya.
Okay. So who will be sharing the screen now?
Mohiddin will be
Yeah.
sharing the screen.
Okay.
It's asking for a request.
Correct.
Send a request.
Sure. It's been accepted.
Okay, I will try now. Yeah.
So by the way, I'll be having a timer here with me.
Mhm.
Okay. Once you are ready, please do let me know.
Yeah. Just a minute. I'm just closing the Zoom windows. Yeah.
Sure, sure.
Okay. Let me know when when we can start.
Yes, you can start now.
Okay. Hi, everyone. Thank you so much for this opportunity, first of all, and glad to be here. So, good evening. I hope you guys are doing well and excited about the next few couple of hours. So, yes, today I and Mohiddin will be walking you through Digi Health, which is a mobile first platform empowering chronic illness patients to better manage their health through various personal insights and timely reminders, etc. Right. So, let's quickly get started. Yeah. Yes. So imagine someone being diagnosed with type 2 diabetes, and instead of just focusing on the lifestyle changes, they are now juggling with scattered reports, missed alerts, reminders, and confusing follow ups, right? So, this is the daily reality of millions of patients nowadays. And today we will walk you through how we are planning to solve this issue, right, for them. So here is the problem discovery that we have done. Yes. Yeah. So if you see the major root cause being poor medication and then missed follow-ups, and the other reason being unable to maintain the previous data or previous records, right? Those definitely contribute to the higher amount of the issue. So with that, let's see the next slide. Yes, so let's see the market analysis, right? So type 2 diabetes is a growing epidemic, and if we have to talk about only India, so we have seen that India is the second highest number of diabetic has the second highest number of diabetic patients as per CMR. ICMR report 2021, and 50% of the total number of patients are being undiagnosed yet, right? And we have also, as per the research, we have also found that diabetes contributes to 1.6 million deaths annually in India itself, which is huge number, right? So what are the challenges? So fragmented data definitely is one biggest challenge. Then comes the poor adherence, right, which contributes to around 50% of the total record. So that, what does it mean? So people are not sure when to how to maintain their medication, diet, etc., or follow up, which definitely worsen their the sugar levels or glycemic levels, and then eventually they end up being at a different difficult stage. Then the preventable complications, which contributes to over 30% due to the poor disease management thing. So what is the opportunity here, right, for us? So because India is the digital health adoption, I mean, India's digital health is continuously evolving and accelerating, and 500 million plus smartphones users and government initiatives, we are using ABDM, the ABHA, etc., right? So there is a huge market here, we can see, and the market is projected to grow around approximately 12%, this complex growth revenue, and yeah, rising chronic disease and digital adoption. So let's see the customer segmentations. We have listed down 6 customer segmentation for the for the platform. Primary focus is definitely on the type 2 diabetic patients and the caregiver or the family members who are trying to manage the health condition of their family members, right? So those are the primary focus for now. And with that keeping in mind, let's see the problem statement. Now that we have understood a bit about what is the issue and what are the root cause, so let's see the scale, right? 90 million adults in India are affected and 45% are undiagnosed clearly. So what is the treatment gap? It's we have seen that 67% of the treated patients still like achieve glycemic control, and and the impact of this is 45% fail to reach the target HbA1c, then 12 to 36% miss appointments due to this lack of adherence and everything, and then 59% face preventable hospitalization due to not knowing about their health condition right on right time. So of course the root cause is the scattered medical data, limited reminders, and then absence of personalized health insights, which definitely leads to the health complications and then health risks. So with that in mind, let's see the vision statement that we have for this platform now. So this is for the patients with chronic illness, caregivers, as well as for the health providers who are currently struggling, with health records and missed follow-ups. They are not able to manage everything from their end. So DigiHealth is trying to or aiming to solve that problem for them, like that part by unifying medical data, delivering personalized insights, customized insights, and timely reminders for medication, diets, etc. So that is the vision we have. So let's see the user persona. So let me introduce you to Anbu Raj, who is 47 years old and is a type 2 diabetic patient. So he is currently balancing his work and personal life. He understands that he needs to update or log every day, but he sometimes frequently misses out on those, right? Maintaining the data and logging the records, he misses out on that. So what is the priority for him? Let's see that. So yeah, so the goal here is organized health records and receiving timely reminders, gaining personalized insights. Those are very, very important for them. And with that, let's see the success factors. So definitely ease of use, because if client is not satisfied with the onboarding and anything, they will not be able to move forward. So ease of use, then personalized insights about their health journey and their medical history, and then reminders, alerts to make them aware of their current situation and future upcomings. Then the integration is also very important, and last but not the least, trust and reliability. That is much more important than anything else, right? So secure storage is definitely contributing to that. So what are the barriers, right? Time and effort. We Everybody is busy nowadays, so we want any of the app to be less effort to be effortless and less time consuming. Then skepticism, because there are already multiple platforms like similar platforms like this, so there will always be skepticism. So how we are going to deal with that? Then comes the adoption, then data privacy concerns, followed by siloed ecosystem which includes various medical reports and labs, etc. So, with that keeping in mind, what was the decision criteria for the client? So, simplicity and convenience definitely contributes to the highest amount here. Then comes the credibility. Then, obviously, it should be cost effective for them to be able to go through it and to be able to use it. And then integration, so that they can have it all in one place. And then outcomes, right? If they don't see the results, then that's the worst part of it. So that is the decision criteria. Let's see the user journey. So now that we have understood what are their priorities, goals, aspiration, what are
You
the
have
barriers?
3 more minutes of time.
Okay. So these are some of the phases: awareness, consideration, decision is when they are planning to, deciding, and then onboarding, adoption. If onboarding is smooth enough, they will refer, and retention comes in. So with that, I'll pass it on to Mohidin from here. Thank you.
Yeah, thank you, Sonali. So keeping in mind with the user research and personas, we have done a empathy map of the thing, what they think, feel, say, and do. So from that, we have mapped the problems with the solutions, the potential solutions for that. So for the unscattered scattered records, we'll be having a centralized mobile platform, and they providing the alerts for the meds, diet, and appointments, and personalized health insights with the data. And the mobile app should be simple, secure, and multilingual platform to adapt the user basis. So keeping that in mind, we have a BMC canvas here with I'll explain more about the cost structure and revenue streams. The cost structure will be of platform development, human resource, and marketing and advertising. The revenue streams we are considering here as premium subscriptions for the AI chats and the medical record insights, and the advertisement and referrals for the hospitals, clinics, and insurance providers through our platform. So we have a UCD canvas where we identify the competitors as EcoCare, DocSap, Care Clinic, etc. And the competitive advantage of us is the AI-powered personalization, ABDM integration, reminders, and mobile-first and multilingual, and cross-user benefits for patients, caregivers, and providers. The unique value proposition will be the personalized health insights, and it is designed for the low digital literacy and high empathy users. So the MEP model would be, we assume that users regularly manage their health data with the help of patients, with the help of caregivers as well. And they prefer a simple, easy upload options, and they prefer a personalized health insights. The hypothesis we consider here is with centralized, easy to manage health records, they feel more control of their health, and with timely reminders, they can able to manage their health. And by the AI-driven insights, they can able to prevent actions, health actions, and the above integration for the centralized data. Our MEP plan is to first conduct research to identify the critical report types that are required for the treatments, and to build a prototype and develop an algorithm for the AI insights. So from that, I will show you the basic user flow that we have created for the sign in, sign up, creating a profile under the integration part, and also the various sections of our mobile app. I will take you these to the prototype. So these are a simple prototype. So where the user download the app and sign in using the email ID, and then they put the basic details here, and then they can create a profile for themselves or someone else if
Your
they are
time's
taking
up,
care of
Sheikh.
yeah, sure. Yeah,
Take another 30 seconds and
sure.
please finish it.
So they can create a profile and link their ABA IDs and link their wearables and other mobile apps, and here they can able to set the reminders, and they can also able to upload their records. They scan and upload from mobile as well, and it will automatically detect the records, and they can also edit the edit options. And yeah, thank you.
Thank you so much, Sheikh and Sonali. Now it's time to get feedback from our juries. And let's start with Prakash sir. You can ask the question and you can give them feedback.
Yes, so first of all, it was very well presented. What I could figure out is the research part. They have done a lot of work on that, and from there they have got that insight, and they worked on the MVP. Um, it's a really MVP. That's why it is called. Small features they have taken, and they have just tried to implement that and see how to take that forward. One question which I have and I did not see during the presentation was customer interviews, documentation of real customer interviews. If they have done it and not documented, probably they should do that. If they have done less amount of customer interview, relied only on secondary research, I would strongly suggest to actually do that. That's a very effective exercise to go out in market. Say, for example, in this case, meet multiple patients, at least say 10 patients, for example, and 10 doctors as well, because while patients may want, some doctors may not want everything to be digitized. Some hospitals want to take control. So what is the real problem there? So unless you actually go and meet these people, will not have the actual problem, and we are done with MVP, we roll out in market, and we may hit the same roadblock which we could have identified earlier. So that was one feedback from my side.
Thank you.
Very well presented. Thank you.
Thank you,
so
sir.
Okay. Now we can move to Ravi Shankar sir. If you have any questions, or you can give the feedbacks to them.
Sure. So one question I had was, so see this product, whatever you're looking at, so you started off with saying that it was for chronic illness, but you had pretty much focused on diabetes. So was that a conscious choice? Is that the MVP that you were looking for?
Yes, sir. Yes. So we are starting off with diabetes for now, type 2 diabetes for now, because that is
Mhm.
the market sector that we have found to be, major one. So, but yeah, eventually we are planning to go for asthma and other hypertension as well. So for
Mhm.
now, it is only. Uh,
Okay, and
I-
extending one of Prakash's points also. So I believe for this particular the idea that you have. So yes, to be sure, this definitely is there is a need for such a thing. I agree with that fully. However, the integration part with, say, hospitals or nursing homes or whatever it is, so that would also be something which is important. And just as Prakash said, if there were interviews that were done at least with,
yes.
say, some smaller nursing homes or clinics, if not
Yes.
probably the bigger ones, which have they may want to use their own app. So that part. I thought it didn't come out very clearly, right? So
Okay.
you may have done it, but during the presentation, that was one part that I thought was missing, right? And another thing is health being a sensitive subject. There would also be some regulatory
Yes.
aspects associated with that. So again, in the research that you did, you mentioned ABHA and then some of the other integrations that are being done in India, but we also have the Privacy Act and some of those things also to consider. So whether that was something that you guys had taken into consideration while you planned your MVP was also something that I would be interested in. If you have an answer for that now, please go ahead and share it. But if not, maybe that's something you can take away and look at to refine the product.
So yeah, I think I would like to answer for the first one. I mean, I would like to start, and Mohidin, please join me.
sure.
Yeah. So I mean, we did we did conducted few interviews, and I think the slide is missing there, but yeah, there were some a certain number of basic questions like behavioral question, then what are the goals, what are the expectation, what is the current problem they are facing. So those
Mhm.
were the basic areas that we tried to cover
Oh,
during the interviews. That part was covered. And privacy related, yes, I mean, obviously health is a sensitive topic, as you already mentioned. So I mean, we are aware of that, and the integration will also include certain, the criterias that are implemented, like HIPAA, or be it Indian Medical Association thing, so it will be integrated with that. So
mhm.
yeah, but Mohidin,
Oh,
please feel free to.
Yeah. Yeah, same thoughts. Yeah.
sure. Okay. Thanks. That was all,
Thank
Aditya.
you. Thank
Yeah.
you, sir.
Thank you, sir.
Thank you so much, sir. And next, Anshul sir,
So,
your
Sonali and
insights.
yeah, thanks for the presentation. I think I like overall content. What I liked about it is the problem statement that you have identified is actually a problem statement and falls into the bucket of value-based care and preventive care. This is a real problem, but is it a real problem for a patient, or is it a real problem for some other persona, which I would want you to go and explore further? Um, it the channel of go to market, as of now, you're assuming it to be patient who would be paying for this app, right? That's what the assumption is. Okay.
Yes, sir.
One of the area that you can also explore is, are there any insurance agencies who would pay for this for the patients? Because eventually the cost of this care that you are saving on for the user is actually borne by the insurance agency. right?
Mhm.
So insurers would want to pay for it in order to reduce their insurance expense. So that's an area that I found missing in terms of the overall go-to-market, or from a persona perspective, whether one is a user persona, but there could be a buyer persona. So think about that.
Got
I would echo some of the feedback that other jurists mentioned. From a value proposition perspective, I think because you add one more persona, the value proposition could have been much crisper. As of now, the value proposition that I felt was AI-based personalization. But how do you differentiate yourself from the competition that's out there in the market? Right?
Yeah.
That has to be a bit clearer, because if anybody wants to buy, or you go into the market and sell your product, your differentiation should be very crisp and very clear. So that's one thing that I'd like you to think about. From the feedback from the customer persona perspective, any feedback, I think this is a real problem. I have some healthcare background, so I completely understand that. But just alerts, is that the only thing why some patient will buy it, or are you adding additional insights across
Yeah.
other care, um, uh, preventive care mechanism? Okay, so
Yeah.
that's
Moidin, would you like to take?
Yeah. So the revenue streams that we're considering, what about the of our premium subscriptions, which include the insights an AI can generate using their past medical records and recommending them what they can be considering for like food and daily activities and everything. And also we'll be sorry. Recommending the doctors, the healthcare providers, and also the insurance providers into our platform. If someone wanted to have a consultation, we'll be having a doctor suggesting for them. So these are future plan of revenue streams we are considering about.
I would just like to add one point there. So there will be a dashboard eventually for the patients, like with their health insights, whatever, how they have been doing, and it's just not about alerts, but also about showing them how uh, what is the health condition, or based on the records, or previous records, what is the current insight, and then personalized suggestions. Okay, you should be taking this medication, or not medication, but diet mainly, and then consultation, of course. And yeah, so there will be a dashboard which will include everything for the patient to know better about their health on that page, so that they are well aware of their current condition. And then that will also help the doctor when they are seeing the page or the dashboard. So I mean, future, obviously we have planned to have a doctor dashboard as well, where they will go and they can see their individual patients and details later. But yeah, that
oh,
is for now.
thanks. By the way, that falls into more of a electronic healthcare record
Mm.
capabilities, which requires, like Ravi mentioned, a lot of regulatory stuff to be involved. Today in India, at least, we don't have that ecosystem. But I think this what the idea is good. This is a real pain area. So I like the problem identification, and the way you have articulated and identified and quantified the problem. What I would like to see more, or what I would want you to do more, is the validation from users, whether they are ready to pay for something like this.
Okay.
Okay.
Thanks.
Sure.
Thanks.
Thank you.
Thank you so much, juries, for all of the feedback and the questions that you asked. Now, we will go for the scores for Sonali and Sheikh. Prakash sir, how much would you score Sonali and Sheikh?
You want me to give the overall score
Yes, sir. From 1 to
out of
5.
5?
Yes.
I think I would go with 3.5. That's the
Okay.
overall.
Okay. Thank you
Uh,
so. Yes, sir. You were saying something?
No, I was saying that there were reasons we discussed about that.
Right, right.
Yeah.
Looking at the integration part, starting with real customer interviews, trying to figure out different players trying to distinguish between buyer, users and buyer. So if we do take these things into account, then probably the overall presentation and the outcome of the app would be much better.
Thank you so much, sir.
Thank you.
Ravi Shankar, sir?
Yeah, I would go with 3.75 out of 5.
Okay. Thank you so much, sir. Anshul, sir?
Mine would be 3.5.
Okay. Noted.
Thank you, sir.
Okay, great.
Thank you, Aditya.
Thank you so much,
Thank
Sheikh
you,
and Sonali.
Sonali. Thank you, Sheikh.
Thank you so much, sir. Thank you.
So now it's audience. Please switch on your cameras and scan the QR code that you can see on the screen, and you can vote Sonali and Sheikh. You have 20 seconds for this. As a viewers, please give insight on Sonali's and Sheikh's presentation. Okay, let's have a look at this. Let's have the look. Oh, we don't have any voters.
It's showing there are no active polls at the moment.
Is it? Give me a minute, sir. Oh, my bad. Yes, can you please scan now? I hope now you are able to access.
Yeah, Aditya.
Okay. Thank you so much for the confirmation. Okay, let's have a look at the scores now. Okay. Uh, uh, Sonali and Sheikh for the wonderful performance, your presentation. Team, you are there?
Yeah.
Well,
I
am
can
I
hear you
audible?
now. Yes, now. I think
You
there
Okay.
was
got
some
broke.
issue in
You
between.
got broke 1 minute before nothing.
Okay.
Now
Okay.
we can hear you. Yeah.
Oh, okay. So we have team 2 now with us. Abhishek, Piyush, Vigneshwaran. Do we have team 2 with us? Okay, it looks like we don't have team 2 with us now. Okay, do we have team 3? Tejaswini, Ashutosh, Abhishek, and Kunal?
Yeah.
Do we have Kunal with us? Ashutosh.
Yes, Kunal is there.
Okay. Do we have Tejaswini and Abhishek and Kunal
Yes,
as
Aditya.
well?
We are all here.
Yes.
Okay, great, great. Okay, let me share my screen. Okay, so who's going to now? You can start presenting.
Yeah, so my team member Ashutosh will be sharing the screen. Let's start.
Just a minute.
Okay, once you are ready, I'll start the timer.
Yeah.
Okay.
Yeah. So
You're good to go?
yes, we are good to go.
Okay, then your time starts now.
Okay. Yeah.
Good evening, everyone. We are Team NutriPal. To start with, I would like to state the daily scenarios that I face as a working mother. My child is just 3 years old. Every mealtime feels like a war. If he doesn't eat, he won't grow. And if he doesn't grow, he'll be weak. This thought troubles me every single day. In less than a year, my child will go to school. And I have just one hope in my heart. I want my child to have food that is healthy, nutritious, tasty, and made with care. But I am a working mother juggling with deadlines and abbas. I have to balance my career and my family, which are both equally important. Every morning is chaos. Cooking, lunch boxes, rushing, guilt. This is not just about food, it's about providing nutrition in every meal for my child every single day. This is about a mother's heart, a mother's worry. And when I spoke to my peers, new mothers, colleagues, and a few others, that's when I realized I'm not alone. This is a problem faced by most of the mothers out there, and this is the real problem Nutripal is here to solve. I would like Ashutosh to take over from here.
Yeah. So in this, to validate the need of the parents, and so we tried interviewing a lot of parents. We also spoke to a few young generation kids, and we also find out that the parents, like mothers, definitely say that, okay, please, we need something to help us and ease out the morning rush. Kids say the healthy food is boring, and they switch over to junk food. And so we tried interviewing a mother, and then this is the persona of a child who will be eating Arjun, who is 6 year old, and this is a mother who is juggling between the kitchen and the work. And we also kept a persona of someone who is going to managing the kitchen, but then to keep it simple, we have kept these two user persona. And we took the interviews, and we not only took the surveys, but we also went out and spoke to a lot of person individually. And these were some of the interview questions. And out of those, it came out that a lot of people, like 47% of people, are actually interested in a meal-based option like this. And so almost more than 65% of people are ready to spend a significant amount of money on services like this. So from here, I would like Kunal to take it over. Like Abhishek, yes. Abhishek, can you go in?
Yes, thank you, Ashutosh. So let me again reiterate the problem. In India's middle class and affluent homes, a new crisis is unfolding. So the crisis is the malnutrition for the child because of their picky habits, and they're getting attracted to the junk food. It is impacting on their overall growth, not only just mental, the physical also. The data shows 22% of the young age students, children are suffering from this malnutrition. 127% rise in obesity has been seen for the age category 3 to 12. So this is happening because the rise of processed food is happening in the market. People are consuming the ready to eat items, and this is what impacting on the health of the kids. So Nutripal, we have had these personas, and then we made the assumption accordingly. Next slide, please. So in Nutripal, we are not just making yet another kitchen or delivering the food. We are delivering the value proposition between three personas. The mother who wanted to have a freedom from the guilt of feeding non-nutritional items to their child. The child who wanted to have tasty and delightful, fun type of food. And the cook. Here comes the major difference that we are creating in the market. the cook we are taking usually is a mother's of mother. I mean, when a girl get a baby, then she is having an option to ask from the mother that what to feed, how to take care of that baby. So we are hiring those mothers as our kitchen staff, as our cook, who has the experience and struggling to get a job in the market, that will connect the emotional balances between the consumer and the delivery. So we'll not be have to focus on yet another setting up or cloud kitchen or something. It is just started from the mother's unit. I would like to call Kunal for value proposition.
Yeah, so to start with, we have talked about a lot of theory. So we don't wanted to talk much upon theory. We wanted to
Last slide,
act.
next.
Am I audible?
Yeah, you are.
Yeah, so we wanted to make in action. So here, majorly, we are trying to partner with Tejaswini mom, who is a homemaker, and she's also helping Tejaswini to handle all those things. So we are trying to partner with Tejaswini mom along with two of our friends who can start executing the ideas at the earliest possible. And apart from that, we have done a lot of surveys, like you have already seen the data. And apart from that, we have also done some surveys with clubhouse events. If you could slide down the slide, Ashutosh.
Next slide.
Yeah, next. One more slide. Yeah. So we have done some of the events. So these are some of the events at school where we have tried to emphasize that why nutrition is actually important. So here you can see on the left side, there is an event happened at Bright Village School where tried to emphasize on why nutrition is important to the students. And apart from that, we are also trying to, in the schools, we are trying to have a parent orientation session where we can reach out to the mass of the people. So here in our next year pipeline, we are having some set of schools who are really interested to integrate this in their in their school to have a nutrition food which is coming from NutriPath. Yeah, Tejaswini, you can start. Yeah. Yeah, Tejaswini, you can continue.
You're on mute, Tejaswini.
So I'm so sorry. So when we did a competitive analysis, so what the competitor product was giving, so we just came up with the brands like Local Tiffin Services, Slurp Farm, Swiggy, and all of that. But the differentiating factor with Nutripal is daily fresh meals, kid-focused nutritional balance, designed by pediatric dietitians, home-style meals, and the packaging and presentation part. And the USP of our brand is to include the nutritional value or the nutritional details of every meal that we give, and gamify the experience, also, and track meal and update to the parent. And
you have 3 more minutes.
Yeah, so I think that is all. It's my product, it's an appendix which we created.
Yeah, to just end it on a good note. So, what is Nutripal? It is not just about nutrition. It's not just about delivery. It is about love, care, and dignity. It is about mothers who don't want guilt, children who don't want boring food, and women who want to feel like mothers again. With Nutripal, every meal is more than just food. It is a bond. Kids love it, moms trust it, cooks feel valued again, and that's Nutripal. Thank you once again. Thank you, everyone.
Thank you so much, team. You were on time. And second thing is, I felt like I'm in Shark Tank at the end. The description that you gave. Thank you so much for that. So it's time to get the feedback from the juries as well now. Prakash sir, over to you.
Yes. So first of all, very well presented. The start of the presentation itself was very nice. I mean, I was gripped how you started the presentation with the real problem. I have few questions. I mean, one couple of things which you have done really well is empathy chart you have drawn very well. You have gone through that value canvas, and you have done customer interviews. You have actually put down the details of the customer interviews. So those were really great. A few points I have is about MVP. Did we create any MVP for the product?
Yes,
Did I miss
yes, sir.
that?
Yes, sir. We have created an MVP. So for to initiate that, we are doing with WhatsApp messaging. So we have
Okay.
created a WhatsApp bot, which is automatically they are getting the details. So we have initiated this with a gated community since each of the individual belongs to a certain gated community. So
Okay.
initially, first outreach is to our community groups. We are having a
Okay.
lot of parent groups. We are having a lot of like community groups where we can circulate this message that hey, we are Nutriball, we are catering services especially for the nutrition for the kids. So this we are trying to circulate from our from our gated community groups. And apart from that, in recently in Ganesh Chaturthi we had a great conversation with lot of parents. And as I have also mentioned that we are trying to have frequently we are trying to have events at the school since there will be parent teacher meetings. So we are also trying to get insight to that and have a communication with the parent that what challenges they are facing and how in the upcoming academic year we can integrate this product with them. Because what we believe apart from B2C
Kunal,
that we are doing.
one more point. During this event, some of the schools internal functions they have created as a competition also. There we have served the food to the child. International schools up to class 7th level. So there we tested our products. Child has also given a very good feedback that yes, they are enjoying that meal.
Yeah, and like major
Wonderful.
of the schools are saying that from the next year they are on the verge to sign an MOU for year-long process.
So I understand is two pronged approach. One is you actually deliver the food, which is based on this philosophy, and you have a tech platform where you are sending out messages, connecting with the community, right?
Yes, sir.
Yeah.
Maybe a slide on both covering both of those would help. And one part which I get normally concerned about these products or concept is how are we going to monetize? What is our future? Who is going to pay for that? While I see a lot of mothers concerned, households concerned about um the food, what quality of food child is getting, they really don't have way to measure it. And even if they get, are they tech savvy? Are they how are they going to take it? Or are they going to pay for it? That's the main question. So what's your idea on the monetization part?
So
Ashutosh,
the
can you answer that?
Yeah, the monetization part and also specifically the nutritional part you said. The value proposition what we deliver is every meal comes with a nutritional info and the UI which we are trying to develop for this is mostly based on the UI basically talks about what's the nutritional info, what the kid had for this particular week. So the UI nutritional score for Shan, we took one particular person and a kid and what kind of nutritional meal and based on the subscriptions, okay, which we will deliver a subscription based model for parents. And the major part of NutriPal is that their parents have the control over what kind of food they get. So when we are onboarding a parent, we see that what kind of food they want, what kind of preferences they want to set for the kid. We have created these type of UIs as well, which talks about what kind of food and allergens and the nutritional info they can track. So that's the whole idea that to make it monetized, bring a subscription based model.
It's
Initially,
through subscription of
yeah.
tiffins, subscription of meal is the main
Yes,
monetization channel.
yes, to get
Yes,
the
sir.
upfront payment of it. And like, let's say 7 days Punjabi food week or a different theme week. So we have created the UI based on that. And the nutritional score tells about the nutrition score or based on the whatever the food the kid had for that particular week.
So
So
there are sorry, there are some players already in that segment. Say, for example, Monkeypox is one player I remember who delivers tiffins directly at school so that parents don't have to prepare food at home with all those nutritional information for those meal. Um, pretty decent player. How are you gonna beat that? What's the difference you're gonna make against your competition?
Yeah, Abhishek can answer
So
this.
yes. So actually, we have gone through that competitive analysis, and here we are again not setting up just a dark kitchen where we will be also handling the same issues. We are building a brand which is connected through the emotion, because it is a very sensitive part where people, parents will not directly trust on somebody. So as I quoted that when Tejaswini had this problem, she got these things sorted out by her mother. So we have been given an opportunity to make cook those mothers who has the experience of those handling those child, and they are getting a chance of reparenting again. So the packaging and the messages will be delivered to them, that who has prepared it, and how safe the product is. Somebody who has a like a parenting experience of 20 years, that trust, that is a part of sensitive issue there we are trying to communicate with our customers, and this is how we are going to create one of the emotional sense of USP to make it connected. And of course, in the future plans, we are trying to integrate the technology where the track of the meal is just not mentioned on the packaging, but rather on the app also they will be getting a track of the meal, whether what kind of items that the child had and what impact it will be giving on his body if regularly consumed. So we have also taken care from a presentation of the design part, where sir has suggested that keep a filter of some as a aspiration part. Somebody wanted to become a sportsman. So in terms of becoming a sportsman, what kind of meal preferences should be there? So these points we have taken care, and we will be working on that to create a USP, and regularly competitive analysis will be done to make ourselves win the market.
Thank you, Abhishek. Just one feedback. I don't need to answer that now, or look at the total market and what is the market you are catering for. This is very niche market. Parents relying on someone else for tiffin, and whether it's gonna be, I mean, how much revenue you're gonna target for that? How are you going to? We are not gonna get into discussion for that, but that's a input from my side. Thank you.
Thank you, sir. Thank you, Afid. Thank you for your feedback.
Thank you so much, sir.
Thank you, sir.
Thank you so much, sir. Next, we'll go to Ravi Shankar, sir.
Yeah, so it was a very nice presentation by the team.
Thank you, sir.
And
Thank
the
you.
handoff between the different team members, all that was handled very well. However, one feedback I had is the okay. So you had mentioned that you would be having mothers of mothers, and I'm assuming based on the overall idea, they are a key part of the platform or the product, right? So that is a persona. I mean, I remember Ashutosh had said that you had considered a cook persona, but then you hadn't kind of detailed it. But if I look at your overall idea, I think that has to be a strong persona. The reason I'm saying is we are talking about people who are probably 60 plus, right? And if the main product is an app that needs to be used by people in that age group, then that aspect needs to come out a little clearly, right? And that in that sense, it's very good that you guys have already done your experiments. You've visited schools, you've probably given some trial and all that stuff, but the product as such is the app, right, which connects a buyer in the form of moms, who are pressed for time, who are worried about their kids nutrition, and people who will actually be able to get address those concerns, right? So you've focused well on the buyer part, but the seller part, I thought it was a little not fleshed out so well. So that is the feedback I have. Otherwise, very neat presentation.
Thank you, sir.
Thank you,
Point
sir.
noted.
Thank you so much, sir. Anshul, sir, over to you.
Yeah, overall great presentation, guys. I love the way you narrated the overall presentation and the problem statement. Clearly, this is a problem that is a very prevalent problem in the market, and the same problem is being solved by multiple different ways. Your way is one of the ways, right?
Yes, sir.
There are healthy snacks market, there are nutrition, protein powders for different age groups, but this is a problem that is attracting a lot of money right now. So I think from a identification of problem, I loved the way you made your decision, which is purely data backed. So I loved the data that you have collected and the way you have made the decisions. Some of the areas that I have few questions on. One of the slides that you presented your competitors, I did not see school as a competitor there. As you know, some of the schools serve food, and if the child is having 2 meals in the school and 1 meal at home, then the scope for your service is fairly limited here, unless you think that the child will have your food at home. So I think that's an area because the target segment that you're looking at, probably both parents working, that's where the guilt factor comes in. Then the child would be going to a school which is probably a long hour school, and the child might be having food at school. So something to think about that as an area. Um, from a product perspective, I felt it's more of a business than a product. The product play is very, very trivial. It's probably more for the collaboration piece between the parents and you, but it's more to do with operations. It's more to do with supply chain. It's more to do with, the cloud kitchen and things like that. Is it fair to say it is a cloud kitchen for kids?
In a nutshell, maybe yes.
Yes, we can,
Yeah.
but not 100% as of now.
Yeah.
Yeah. So yeah, I think from that perspective, the competition, I think you really need to look at again. There are certainly things that you will differentiate on, and on differentiation, think beyond the first engagement of 1 week, 2 week, 3 week, 4 week. What is that will keep your subscription running over month? That was something that I did not really see. Like, what is that thing? Is it just the guilt? It cannot, if that's the only thing, then we need to really think through of what is the value that parents will see apart from the nutrition dashboard that you will provide. Is it more materialistic thing that you can provide? I don't know the answer, but if you have given any thought of beyond, if someone has taken 3 months subscription, what keeps them going beyond that?
So that point we have taken in the design classes also. So we have then started working on based on the personalities or the aims that particular child and parent is having. Suppose somebody wanted to prepare for IIT type of entrance examination. Then parent is serious to continue such a diet that affects directly on their brain. So definitely they'll not try for 1 or 2 weeks. They'll go on the long run, and we need to showcase that report as like how physically or mentally he is getting trained, and in between of 3 months or 4 months certain body checkup which shows that how this particular health has improved from the previous diet, and what are the things coming as a impact, whether the child is feeling lazy or he is became active or his study hours increased or not. So those type of tracks is a part of future. As of now, we focused more on the MVP and 0 to 1 GTM that we can like do it within a week. That actually got from the feedback also. So that's what we have presented, that particular thing. And those things are already in consideration. We are working on it.
Got it. Thank you.
Thank you.
Yeah.
Anshu sir, one more, yeah, no, you can say.
Yeah, one more thing, we are also looking for detailed mentorship from your end so that we can really take this product idea not only for the sake of Skillathon or a presentation sake, but we're really interested to take this product in the market and further take it for a scalable solution. So we will be really interested to be your mentees and understand deep down about the product.
Is it for me? Sorry.
Yes, yes.
Yeah, it is for you.
I'm not an expert in this area, but I'm happy to spend time and discuss if you have any questions.
Yeah,
So the
sure.
point is, sir, we are struggling, as you said, one point, we are struggling actually to productizing this process. So in that case, I think if some sort of mentorship we could get, it will help us to definitely work on that.
Sure. I mean, I'm happy to spend time in whatever way I can help you. I do some other incubation with some other startups as well. So happy to engage further on this.
Thank you very much.
Thank you very much, sir.
Thank you so much for that, sir.
Thank you so much, team, and all the juries. Now it's time to get the scores for our team. Prakash, sir.
Yeah, so it was a great presentation. And I would score it as 4.1, little above 4.
Okay, thank you so much, sir. Ravi Shankar, sir.
Yeah, my score is 4.4 out of 5.
4 point?
4.4.
Okay, 4.4. And Anshul,
Yeah.
sir?
I'd go with 4.2.
Okay. Thank you so much for your feedback and
Great presentation, guys.
Thank you, sir.
Thank you, sir.
Aditya, I think your video got freezed or your voice freezed. Oh, sorry. Excuse me.
Yeah, that's his only.
Hello? Uh, Am I audible?
Yeah, you're audible.
Okay, okay. I don't know, something happened, just Zoom switched off automatically. Uh, okay. Now am I audible, right?
Yeah, you're audible.
Okay. I'm sharing my screen. Is this visible to you? Is my screen visible to you?
Yes, yes, sir.
Yes, sir.
It's visible.
Okay. Can you check if you can scan this QR code?
Yeah.
Okay, great. So could you please cast vote for Tejaswini, Ashutosh, Abhishek, and Kunal for their presentation and their idea. Please cast your vote for Tejaswini, Ashutosh, Abhishek, and Kunal. Okay. So I hope we have got some results for this. Okay. Thank you so much, team. Thank you
Thank you.
so much
Thank you,
for your
Aditya.
participation as well. And now we have Abhishek Singh, Piyush, and Vigneshwaran. Do we have the team now?
Yes, Abhishek, only I'm here.
Okay,
So
you are
I'll
there.
start the presentation.
Okay.
And
Yes.
actually, I've joined in a different laptop, so I'm unable to present the original one which I need to do in the Skillathon template. Is that fine? I have the
Yeah, yeah,
original.
yeah. No, no problem. No problem.
Yeah, okay. Just a second.
Okay. Once you are ready, I'll start with the timer.
Yeah, I'm ready.
Okay. You can start your presentation now.
Yeah. Greetings, everyone. So the product name is Solar Cold Storage, which is basically designed for farmers, uh, especially for marginal farmers who relies on their produce, on vegetables, fruits, and dairy products, which are easily perishable due to the temperature, due to the atmosphere. So these are the agenda side. We'll start over with the customer segment. Jobs to be done, pain and decide again, proposed solution, gain creators, skill, painkillers, USP alternatives, assumptions, and hypothesis and experiment. So let's talk about the backbone of Indian culture. Our small and marginal farmers, they make up to 89% of all farmers. Yet they face a critical challenge year on year. India loses up to 1.5 lakhs crore annually in hours losses. This is primarily because of lack of proper storage. This forces farmers to sell their produce immediately at low cost in the market. This is similar to robbing them of their income. Our FPOs and NGOs plays a crucial part in supporting these farmers, and even though with their support there is a gap around their income. Moving on to the jobs to be done, their functional job is to timely crop and sell their produce and manage the logistic as well. The emotional job is to seek stability and feel pride in what they're doing without any fear of losing or going on debt. And social job is to gain respect in their community and build trust so that they can develop their own and the community economy. By addressing these jobs, pains, and desired gains, by providing farmers with a better access to storage, markets, and collective bargaining, we can do more than just improve their livelihoods. We can directly enhance India's food security and make a tangible dent in the substantial post-harvest losses that are currently a huge economic impact. So, moving on to the proposed solution. As we have discussed, the small and marginal farmers face critical challenges with the post-harvest loss. The solution is smart solar cold storage. We propose deploying an off-grid IoT-enabled cold storage units in key rural areas. This isn't just a refrigerator, it's a smart system. It runs on reliable solar power and uses predictive analytics to maintain the perfect temperature for the produce, preventing spoilage and ensuring farmers can store their produce at the low cost and a sustainable resources. This is a collaborative effect of NGOs, FPOs will handle the farmer training and trust building among the community. State and Agriculture Department will provide crucial subsidies. Solar panel supplies will ensure a sustainable power source. And finally, we have agri-tech startups will provide the cutting edge IoT and remote monitoring technology that make it all work. By bringing these partners together, we can empower farmers, secure our food supply, and turn a massive national loss into a story of innovation and prosperity. Uh, so these are the expected gain creators by deploying our proposed solution. The extended shelf life, choose a better market. It allows the farmers to decide which market is better for them for the selling cost, optimize the usage using IoT. They can track the real time track their produce and the units conditions, and if they want they can extend or cancel the booking unit at any time. It reduces spoilage and accessibility for all the farmers. The painkillers are optimize storage conditions, prevent spoilage, control storage, and ensuring consistency in the operations. A unique unique selling points are the key feature, the IoT enabled solar cold storage, the scalability of the modular unit, pooled or individual use, sustainable power, 100% solar power, reducing the carbon footprint, and data tracking optimizes usage and prevent spoilage. And we have also introduced an integrated system which works seamlessly with government schemes and co-ops. These are the current alternatives that our farmers use. To understand the value of a solution, it's important to look at what farmers are doing today. Many still rely on the traditional storage methods like mud house or jute sack. These are affordable, but they offer little to no protection against this foliage, especially for perishable goods. Another common practice is immediate market sale. A farmer will harvest their crop and sell it right away at the local mandi or to a middleman. This is a huge problem. It floods the market, drives down the prices, and leaves farmers with very little profit. For certain crops, farmers uses chemical preservatives, things like wax coating. While these might extend shelf life slightly, it often comes with health and environmental concerns. These are also grid powered cold storage units, but they are typically large, centralized facility located far from the farmland, often near urban centers. They are expensive, hard for small farmers to access it, and vulnerable to outage. Some of the FPOs and cooperatives started offering shared storage, which is a step in the right direction. However, these are not widely spread and still rely on constant, often reliable supply. And finally, we have some farmers using home refrigerator for very small batches of high value items. But this is simply not a scalable or viable solution
We have 3 more minutes, Vigneswaran.
for the vast majority of the produce. So these are the following assumptions that have been made so that we can create an hypothesis and an MVP. Our hypothesis one is this is our core hypothesis where the Indian farmer will adopt the cold storage if offered at a fair and flexible payment model. To validate this, we are launching a pilot project. We deploy 5 smart cold storage units across the 3 states, BR, Himachal, and Gujarat, offering 50 farmers a choice between 2 pricing options. We'll track the usage and the payments and conduct a survey to measure the perceived value. Our goal is to prove that our solution is not only technical success but also a financial sustainable one that truly meets the needs of the farmer. A second hypothesis is to cut down the spoilage by 50% at least and boost farmers' income by 20%. We'll measure and compare the spoilage and sales revenue uh, for both group over one season, and our success will be clear, verifiable one, increasing in income, proving that solution is not only effective but also financial transformative for the farmers. A third hypothesis is to can the solar cold storage units handle India's extreme summer heat? To verify this, we deploy 3 prototype units in odd regions like Rajasthan for 3 months. This is an optional hypothesis. It can be done. It's not a core one. Our IoT sensor will monitor the temperature and the battery performance for 24/7. We will also simultaneously simulate the full capacity and test their resiliency during the cloudy conditions. Our goal is to prove these units can maintain the temperature below 5 Celsius for 95% of all time. And a final hypothesis test is our ability to scale. Can we effectively partner with local organization? We believe at least 70% of NGOs and FPOs we approach will agree to partner, and we can onboard 50% of their farmers. To prove this, we will approach 10 organizations across 3 states. With our partnership module, we'll track their partnership module, track their engagement, and measure how many farmers have successfully onboarded. This is a simple lo-fi wireframe.
Your time's up, Vigneswaran. Just take another 30 seconds and let's wind up this
Yeah,
presentation.
sure.
Yeah, thank you.
So this is a simple wireframe where we have the login page. It takes to a home page where the farmers can check the unit's details before their booking. They can book a unit at any time, and they can select the number of days. It should be minimum 7 days. And of course, even in 3 days, they can take their produce at them. But initially, they should be locking 7 days, and they can check. They can extend or cancel the booking units as well. Thank you.
Thank you so much, Vigneswaran. Thank you for your wonderful presentation. and let's get the feedback from the juries now. Prashant sir. Sorry, Prakash sir. Do we have Prakash sir with us? Yes, I think we can go with Ravi Shankar sir then.
Sure, Aditya. So, Vignesh, I have one basic question. So, what exactly is the product or solution?
The solution is we deploy a solar cold storage so that the farmers can access it and store their produce so that it is not perishing before the sale.
So,
Bec-
it's a hardware product.
It's like a storage unit, like a warehouse, like the hardware. Yes.
Okay, so that, I mean, have you thought about, where this will be located? I mean, where is the land? Who does the building? And, how do you,
Yeah, initially I was not thinking about it, but after my second course, I had a different idea like to deploy a portable unit. Like it
Mhm.
can be a shift, it is a small, concise one. It is easy to set up and it has a simple infrastructure. So we can deploy it in a big R where 80% of the economy is relying on farming, and it has greater than 45 percentage of temperature. Sorry, 45 degrees Celsius. So yeah, this is the second phase, but I don't want to touch the original slide because the one I made the changes was with another laptop. I was facing some issues. That's the reason. Originally, it started with a building a big warehouse, cold storage like that, but now it's at a stage where we can also deploy a portable unit with a simple infrastructure.
so what is your MVP then?
Yeah, that would be my MVP, the portable unit. Before building a big cold storage, I can deploy a portable unit and give a trial run to the farmers, access it, and then we can start one by one.
Okay, even in that case, you would still need to think about a lot of stuff, right? Like what
Yes,
is the material, and if it has to be portable, then how exactly will it be solar powered? All of those.
yes.
So have those been covered in a different slide or?
No, no, sir. Because I need to interact with the direct persons like the agri-tech startups to understand how IoT works and is this a feasible solution to have it. So yeah,
Okay, so because as part of MVP, you showed some wireframes, but that would just be an interface, right? I mean, your actual product is either a warehouse, as you told, or it's going to be a portable unit, right? One of these. And the app or whatever it is simply going to be something which an user interacts with. And that's not your core product or
yes.
solution, if I understand correctly. Okay. So how about any customer interviews or yeah, any such thing?
Yeah, actually, I'm located in Chennai, so most of the elderly people done farming in their time. So I've interacted with them like
Mhm,
orally, like how you manage the farming, and they say different stories, but
mhm,
uh, simply they don't understand what I'm trying to say. And I'll
mhm,
finally end my uh, like conversation like it's a fridge. It can
mhm.
store anything, but it's a big fridge like that.
Okay. Okay. All right. I mean, the vision is grand, but I guess it's a little bit short on details. So,
Yeah, understood.
okay. Aditya, that's all for feedback.
Thank you.
Thank you, sir. Thank you so much for your feedback. Anshul, sir.
Yeah. Thanks, Vignesh. I think you have picked up a great social cause product idea. I would not call it a product idea again. I think it's a business idea because this is a very capex intensive business. which also required a public-private partnership. So I don't know how much of a private investment can actually make money in this kind of a setup. But there is a certain social aspect to this overall idea that I liked about. You had good hypotheses built in, and you had a path to validate those hypotheses. However, the execution of those needs to be seen, because what was missing in the presentation, at least, was a good data set of customer interviews. And it's not just user interviews, the holistic journey of the user, of how the entire supply chain of your cold storage comes into picture, into the existing way, the way it is being done today. I think that was something that I felt was missing. Like, how are things happening today? How will your cold storage, when they come in, will change the things, right? And then what is the value add that you will bring in by the cold storages? I think that was something that I felt was missing. There is a need for it, but what is the value? That was not clearly articulated. Um, then on the capex side of the business, how do you intend to make money here? Is it through the farmers paying to you directly, or is it some other ways? And is there any financial planning also that was done, or any propensity to spend analysis with the users that was done?
To be honest, not in depth, but it's going, if we are going to make it profitable business idea, it's going to be a long-term idea where we will be needing support from the government and the FPOs. Like, they'll be our foundation to build this idea. The three crucial things are the FPOs, NGOs, um, the government subsidiaries, and the agri tech startup.
Okay. And have you done any analysis on the unit economics of what would it cost and what is the share of subsidies that you would get and stuff like that?
No, sir.
Okay, sure. Sure. Thanks, Vignesh. I assume you are the only one handling for your team today?
Yeah, yes.
Sure. Thanks.
Thank you.
Thank you so much, Anshul sir. We have Prakash sir with us.
Yeah. So sorry, I had issues with my audio.
Okay.
So Vignesh, overall, it was good vision, and I can really connect with your idea that there's a need for this. There's a huge unserved market. It may not be in the leader states right now, but there are a lot of laggard states, areas where we have enough produce, but we are not able to protect it. So there's a good market for this idea. However, for that exercise here, I mean, there are certain areas which Anshul and Ravi has pointed out. We have not done full exercise, like going out more farmer. You mentioned that you talked to some farmers, but we need to document that. How many farmers you talked? What questions were asked? How did you figure out their propensity to pay? What mechanism they would pay? I mean, in one of your app, you were mentioning credit cards. I mean, even city guys don't. All of the city guys don't have credit card. Do you really expect farmers to have payments through credit cards? So those are the basic idea we need to really look in detail. Plus, one highly important point was this is a capital intensive project. From a research perspective, if we don't have enough capital with us to really invest, say at least one cold storage or two cold storage, forget about the whole chain, then we need to look at do a research on all agri-tech. You mentioned just agri-tech, but what agri-tech? What areas they are working on? Have anyone make breakthrough in the technology terms, cooling technology terms, or mm, have you researched about sourcing those technology? I mean, we don't need to build everything in house, but we could have done analysis on sourcing. I mean, the easiest way to get started is source some of the ready-made technology from China. People get started with that, and there's nothing wrong in that. I mean, that's the Kickstarter while we are building something foundational. Uh, so some of those research aspect is still lagging. From government perspective, also there are huge amount of agri-related incentives are being given. One good research would be on that area itself. How many incentives are being provided, what area, what all you can get for your startup, which ones are relevant. So if you get those information, that would also be a valuable aspect. So one of the main points still remains that how are you gonna get payment from your end user, customer? Is there any way we can tie up with large organizations? Say, for example, there are processing units. So if we can tie up with processing unit on one side and connect with farmers on the other side, you could figure out a mechanism through processing unit instead of taking it from farmer side. So those are the aspects also you can look into, maybe beneficial. And not to discourage you, for your encouragement, there is one example which I have seen or heard a lot about. Everyone must have heard Mr. Kostlendra from Ahmedabad. He actually quit his, I mean, he was the topper of his batch and he quit his high paying job. I mean, he did not even take that. And he went ahead and started in the cold storage unit segment itself in Bihar. And his area was vegetable vendors. So he created a portable vegetable vending machine, I mean, the cart, where the vegetables would be fresh for whole day, maybe 5, 6 hours, 10 hours, till everything is get sold. Otherwise, if you go and look at the vegetable vendors, after a couple of hours, after say 10 a.m., it looks very dry and no one would want to buy. And sun is so hot, no one want to venture out. So it was there. So need was there, but he started with 1, 2, 5 carts and started connecting with farmers directly. So there is definitely a need for this one also, huge demand. But we need to think through how are we gonna secure investment, capex planning, units of economics, how it will work, and convince customers, farmers in their language, and also find out alternate mode of revenue generation, which could be from food processing units. So I would say that, I mean, if you are serious about this is worth pursuing. And
Sure.
these are the details, these are the feedbacks. I mean, with all those feedback and little help, you can figure things out as you go along.
Yeah, sure, Prakash. Thank you. Thank you for the feedback.
Thank you.
Thank you so much, sir. So we can go to the scores.
So if I have to give on the
Yes, sir.
score perspective, purely based on how much research and work is done, the presentation side and the ideation side, it would be around 3.2.
Okay. Ravi Shankar, sir.
Yeah, so as I already mentioned, idea is very good. There is a social element to this as well. But as Prakash mentioned, probably the team needs to narrow the scope down a bit. And because from the point of view of the presentation itself, customer interviews and personas were not really something that came through very well. I'll go with 2.5.
Okay. Thank you, sir.
Go with
And
2.8.
okay, sir. Thank you so much for your scores. Thank you, Vigneshwaran, for your presentation. And again, you can cast your votes for Vigneshwaran. You'll be having 20 seconds of time.
It's not coming, Aditya.
It's not.
No.
Give me a minute. Yes, can you try now?
Yeah, it's coming.
Okay. Okay. Let's have the look at the scores for Vigneshwaran. Okay. So we are at the very end part of our Skillathon. Thank you for the participation and thank you for all the jury members. Before we announce the Skillathon, I would request juries to accept this participation of certificate, appreciation of certificate. Prakash sir, please accept our certificate on behalf of IPL. And I would like to, few words on your experience today.
Uh, Thank you, Aditya. It was really a wonderful experience. Wonderful in the sense that I see young people learning the product management concepts, not by just reading books and concepts, but applying that in real world scenario with real ideas and putting their heart and soul into that. And one thing with all this Skillathon is, I would say that someone has better presentation, someone has better idea. Uh, End of the day, it may not matter too much as long as you are ready to continue with those ideas for a longer period of time and see it through. So all the best to all the participants, and I really think that a lot of you actually take plunge and follow through with your ideas. These are really wonderful ones.
Thank you so much, sir. And here is the certificate for Ravi Shankar sir, a certificate of appreciation from IPL, and few words of about how your experience was today.
Yeah, it was definitely insightful. There were quite a few good ideas, and uh, yeah, it is nice to see the cohort actually thinking things through and then coming up with actionable things to take further. And yeah, it was time well
Thank you.
spent, I would say.
Thank you, sir. Thank you so much for your kind words. And here we have a certificate for Anshul sir. This is a certificate of appreciation from IPL and few words from you, sir.
Thanks, guys. Thanks for the opportunity. I thoroughly enjoyed my conversations today with the exciting groups and the business ideas that they brought to the table. Because the session was mostly focused on customer centricity, my only recommendation is to, in product management, the most important thing is to know what you can't know. And the only way to know what you don't know or you can't know is to talk to your users, understand their journey, understanding their day in the life, and getting into their shoes to really understand whether the product will solve their problem or not. And this should also be looked at from different perspective or different type of users, different stages of engagement, initial users, long time users, etc., etc. So you need to really create those moments of aha into the product. I'm talking specifically about SaaS products here, but whenever you handle some of these products, because our roles are not very outbound focused, so we don't really get to talk to our users on a regular daily basis. It really helps to pause and then talk to some of the users to really understand from the value perspective of what they feel, what's the feedback, the customer feedback loop, all of those things. So, but I think some of you did a great job of it today. So really appreciate that and all the best.
Thank you so much, sir. Thank you for your words and the feedback as well. Now it's time to announce our Skillathon winner. Before that, let me share my screen. Before that, I would like to say that the Skillathon winner gets a cash voucher of ₹1,000 as a small award to them. And I think we already have a clear picture of who the winner is for today's Skillathon. And the winner is Tejaswini, Ashutosh, Abhishek, and Kunal. Congratulations,
Thank you so much for
team.
that. Yeah, thank you so much.
So once again, congratulations to you, and please share your words, how you felt about today's experience and today's feedback from the juries.
Definitely, it was.
If you could come on camera, that would be really great.
Yeah. Yes.
Thank you so much.
Definitely, it was very insightful. I mean, actually, we got to know about this Skillathon. We got selected yesterday afternoon, and we kind of, scrambled everything and got ready within one evening. And I think just an hour before or so, we just did one round of presentation, and that's all we presented. And then, yeah, it was one of it's been a great one, and for every subject of ours, we have presented the same idea, and we are trying to refine it as we go ahead with each subject. We are trying to understand how we can apply to the same one, and we have kind of refined it much more than what we have done now. And what jury members have said, definitely the feedback we will try to incorporate and those start working on the advice what we have got.
It was a wonderful teamwork. Thank you so much for your time and efforts. And let me share my screen here. And here is the certificate that you have won this Skillathon for today. And thank you so much, everyone. Thank you so much for all of you being here and making this day a successful Skillathon. And thank you, juries, as well.
One point I would like to add, Aditya.
Yes, please.
So, first of all, thank you very much for giving this opportunity, and thank you very much, jury members. The feedback that you gave is really useful, and the vertical of a competitor, that school as a competitor, what we have got from Ansul sir was actually really eye-opening, because we were thinking to collaborate only with the school. We were not thinking school as a competitor. So that input and this type of competitions is actually useful in that sense of getting those feedbacks. Thank you very much, sir.
Thank you everyone for being a wonderful audience, and again, esteemed juries for being a part of this Skillathon. So let's end this session here. Good night, everyone. Take care, and let's catch up.
Thank you.
Thanks, everyone.
Thank
Bye.
you.
Thank you so much. Bye bye.
Fun.
Thank you. Happy weekend.